Hi, I'm Dr. Ashley Fuller.
And I'm Dr. Meredith McClure.
And this is Labia Logic,
the podcast that's all vulva, no filter.
We're here to talk about all the stuff your doctor rushed through, the questions you've been too embarrassed to ask, and the sex ed that barely mentioned the vulva.
Because too many people are suffering in silence with painful sex, menopause misery, and vulvar issues no one talks about.
No shame, no stigma, just real talk, real answers, and the education you should have gotten in the first place. Hello there. Welcome to Labia Logic.
Hello. Welcome back.
Yeah, we're here to talk about vulvar hair care. To bush or not to bush?
Yeah, the hair that's down there.
The hair that's down there. So we're going to talk about pubic hair, and we're going to talk about why we have pubic hair, what it's there for, how you can take care of it, and some trends that we notice.
Definite trends that we notice, but do we really notice?
That's a really good point, Meredith. One of the things I was going to say is that we as gynecologists hardly ever notice your pubic hair. I just want everyone to know that.
Yeah, we're not judging. We actually don't care what you do with your hair down there.
I had a patient this week who told me before the exam, Dr. Fuller, I just want to apologize. I have full-on 70s bush going on. And I laughed and I said, honestly, I wouldn't even notice. Unless there's some problem in the mons pubis where the hair is, it's just not something that I'm actively keeping track of or taking notes on. It's not in my physical exam notes. It's just not something that we think about.
Yeah, it's nothing we even notate in our documentation. Do we say anything about pubic hair being there, not being there, how much is there? It doesn't even apply to us clinically.
Yeah, patients are often so worried about what we're going to think about it. I mean, that's such a common thing for patients to tell us. Oh, I didn't shave or I didn't do this. And it makes me feel, sad because you shouldn't have to prep to come see us.
Please.
You can just be yourself because that's what we want.
Yeah.
As we were prepping for this episode, I told Meredith, I said, well, maybe we could do something kind of comparing culturally, like what people in Seattle do pubic hair wise versus Dallas. And then I realized I can't actually answer that because I don't pay attention to what people do.
We do not pay attention whatsoever. I would have no idea what to say on that question, actually. So,
yeah. So we just want to start this out with, it doesn't matter to us physicians how you wear your hair. It is a personal choice, and you should wear what makes you feel good. But we will talk about, as we talk about ways to trim your hair or ways to take care of your hair, what's the healthiest way and where you could get into some problems.
Yeah. Say you are going on that beach vacation and you need to wear whatever bathing suit you're wanting to wear. We can help you to do that in a way that's potentially going to be less problematic for you on that beach vacation.
But why do we have pubic hair? I mean, is there even a reason for it?
I mean, clearly it has to be there for a reason. We grow hair in places for a reason. So why do you think that is?
It definitely helps with friction. It helps protect your precious parts, right? That's what we're talking about. It's going to help protect these sensitive parts like the vulva, the labia. It helps create some moisture there so things don't dry out as much. And there's definitely an evolutionary reason to have it. And it may even actually protect against infections and things like that.
Yeah. And, maybe way back when it helped regulate their body temperature. Who knows? To protect those reproductive organs. I don't know.
Sure.
Maybe.
But why do we get rid of it then?
Don't totally quote me on this, but there was probably a time that pubic hair disappeared in magazines that showed female anatomy to their fullest. And then and I think pornography.
As porn has gotten more accessible and more popular, seeing women in porn with no pubic hair at all, I think has made more people think that their partners are looking for that or make them feel more sexy. And again, it is a personal choice. There's absolutely no judgment here. But I think that was part of the trend of having less pubic hair is partly just what people think, what looks sexy, right? And is pubic hair dirty? It's not. It's, like I said, it's supposed to be there. But I think people looking to feel sexy or that what they define the lack of pubic hair as sexy.
Yeah. And I think having an open conversation with your partner is always something you can do in these scenarios. And we should have more open conversations with our partners about these things.
Yeah. But I was looking at some studies on this for people with male partners that most of them don't care. The vast majority, like 80%, don't generally care in some of the studies of what the hair is, if it's full bush or totally shaven. So that's why I always think, I mean, I think talking to your partner is great, but I also think what makes you feel sexy and you feel good is, one of the most important parts. What is the safest way to manage hair? What do you generally tell patients?
I mean, trimming's going to always be the safest way to do it because it's going to keep away from the skin, which that can be sensitive skin for so many people.
Right. Yeah. So trimming is going to keep that sharp razor off the actual skin and leave a little bit of hair there. So you're going to have less likelihood of getting infections and less likelihood of getting ingrown hairs, which can happen after shaving with a razor right on tight skin.
Yeah, and that's when that hair that you've shaved off at the level of the skin is growing back and trying to push back through the skin, and that can be really painful for a lot of people and cause them to have some problems.
Other ways that you can remove hair would be waxing or sugaring, but definitely painful
Costly.
and costly and a lot of upkeep. And you definitely can get some burns with it. So they don't recommend that you put lidocaine or something on to numb ahead of time because it actually can cause burns and you may not feel them, but can have problems later.
Yeah. Then there's the creams you can buy over the counter, the depilatory creams, and those can be irritating to skin sometimes.
Yes. I mean, the vulvar skin is very sensitive skin. If you're using kind of harsh chemicals down there, it definitely can cause a lot of irritation. And as Meredith and I both know, sometimes if you have a major allergic reaction or sensitivity, it kind of can set your cells down a pathway of inappropriate inflammation that sometimes leads to chronic pain, things that we don't want. So always careful about what touches the skin down there because that skin has a lot of memory, which sounds funny to say, but that skin I feel like is just easy to get amped up with like inflammatory cytokines and then has a high memory of remembering that and like continuing to be inflamed.
Yeah.
Wouldn't you say, Meredith?
Yes. And we definitely see people who have irritation to their skin from products and things that it becomes a cycle of a chronic itch and scratch, which can be very debilitating, and people really can suffer with that and need to seek help from vulvar specialists like ourselves to alleviate that. So the best thing would be to avoid that altogether if
Right.
possible.
Right.
So
So I wouldn't recommend the creams, but if the other if that's what works best for you, then you could do that. But I'd be worried about any reactions you could have to those chemicals.
yeah.
There's also laser hair removal that you can do, also very costly and also can cause some burns and irritation, but definitely could be helpful. But I think trimming is the one we recommend the most.
Yeah. Yeah. Lasers, are very costly. There is one instance where possibly laser could be beneficial, and that's in hidradenitis suppurativa.
Sure. Why don't you tell our listeners what that is?
It's hidradenitis suppurativa, which we call HS, a skin condition, and it can happen where the hair follicle under the skin ruptures under the skin, and that debris gets underneath your skin and is really irritating, and it has to find its way out. Patients will often tell you they have boils, but you can also get kind of these tracks, and they will drain this material, and it's really irritating and painful. It can happen in the underarms, under the breast, and in the pubic area as well. And because it's an actual kind of problem in the hair follicle itself, ablating that hair follicle with a laser can be beneficial for these patients.
Yeah. The patients who have HS tend to get a lot of pain and a lot of scarring and things like that.
Uh-huh.
So that definitely can be helpful.
Yeah, and that definitely impacts them even psychologically because of the scarring that happens. So,
Absolutely. So, what are some other trending styles that patients, we talked about how we remove it, but there's also this kind of stylistic options that are out there, right?
there's shapes.
There are shapes.
Yeah.
There's landing strip shape, so kind of just in the center.
Yeah.
There's reverse triangle.
I've even seen people with various jewels stuck down there.
Yes. They in the article I read, they called it vajazzling or vajazzled. But what would you call it, Meredith?
I mean, it's not a vagina, it's a vulva. So I would call it vajazzle.
Yeah,
Does that sound right?
vajazzled, not vajazzled.
Vajazzle.
I've heard that the full bush is coming back in style, that there's more hair, like people are kind of going back to the more au naturel and they're not clear what that's about. But some people
Yeah.
said, back in COVID when we didn't go out, although I heard there were mobile services that would come to your house, which is kind of crazy. um don't worry, honey, I'm just going into the next room to have myself waxed.
Get my vajazzle.
Yeah, I get my vajazzle. Priorities, there's important things. But during COVID, like people didn't go as often. Maybe they got more used to having home hair care
Yeah.
and
Yeah.
realized that maybe they didn't need to pay for it. Or maybe just the trends are changing toward more au
Hmm.
naturel and realizing that maybe there is some benefit or even less irritation on some of the skin with some pubic hair there.
That'd be something to find out, what's the difference between Seattle and Dallas now? Who knows? But again, we're
Right.
not the ones looking.
I mean, we are looking. We're just not paying attention to that
We
part.
just move right on past that part.
We do. We do. How does pubic hair matter to our health? What are the health implications? Does it change like our risk of sexually transmitted infections, things like that?
It's clearly there for a reason, and it can reduce the friction, irritation in that area. And, if you have shaving and things like that, that can increase your risk of just skin infections and
Right.
things like
Skin
that.
infections,
But what
boils.
about
Once
sexually transmitted infections?
Yeah, one study I looked at showed that there was a higher risk of sexually transmitted infections like gonorrhea, chlamydia for people who did more hair removal. But I definitely think there's other factors at play there.
For sure.
Whenever you have skin to skin contact, there's other things you can pass along, like HSV herpes virus or HPV human papilloma virus. A study I looked at did exclude those things from it and was just looking at gonorrhea, chlamydia. So, but like I said, we mentioned it is there for a reason. It doesn't mean you have to have it, but it may reduce irritation, friction, and may potentially reduce the risk of STIs. But I don't
Yeah.
think it's a major thing.
Now, we do see a lot of patients who have dermatoses like lichen sclerosis or lichen planus. Do you feel that hair removal for them, is it good? Is it bad? What do you think?
I think it can irritate that skin. That skin. So, like lichen sclerosis is a autoimmune disorder, dermatologic autoimmune disorder that causes whitening of the skin and some thickening of the skin, and that skin just becomes more scarred. And I think that when we, are removing hair in that area, it's not necessarily on the same areas, but really close by that it can irritate. Or the methods we're using to remove the hair can irritate it, like especially chemicals, but also waxing even shaving. So I definitely think it can affect those things.
Yeah, you make a good point because these skin disorders typically live a little closer to the opening of the vagina and not like in the quote unquote bikini line, where if you need to go on a trip and you need to wear the bathing suit, that would be totally fine for them to remove and do it in ways like we discussed, or whatever your skin can tolerate or what you like to do that works for you. But I think, if you need to go completely bare and you have one of these skin disorders, it's best to have your skin disorder in kind of in what we would call an inactive state, because we can help you to get to that point where the skin is not as easily torn or irritated. So if it had to be, like, it's not terrible.
Agreed. One thing we haven't talked about yet is what happens when we get into perimenopause and
Oh yeah.
menopause and how hormone changes change our hair.
Yeah. Well, I mean, fun facts, the hormones do work in our vulva. I mean, there's a reason that you and I are menopause certified and treat women who have these concerns, because it definitely also impacts their vulvas and their vaginas. And you look at a prepubescent girl who doesn't have labia minora, gets labia minora in puberty, and then they actually get smaller when you go through menopause. So the pubic hair, of course, was got to change too. Prepubescent girls don't have pubic hair. You go through puberty and pubic hair shows up. Well, as we go through menopause, it kind of gets less. And
The bald spot. My patients tell me they notice a bald spot on their pubic hair and, they're menopausal and they're
yeah,
like, where is my pubic hair gone? I
yeah.
mean, how does it just disappear?
I think you said you told me maybe get a toupee.
Right. And that's a thing. There
Yes.
are, there actually are toupees for your pubic hair, you guys. I mean, I had to look this up. It's called the Merkin. You can buy it on Amazon.
Yeah, right to your doorstep. Different
Um,
colors, you name it,
yep.
it's there.
And different styles
Yeah,
too.
I mean,
So as we age, our pubic hair changes. It becomes more wiry, less full, and it covers less. And so you definitely can get some bald spots and areas where it's not growing as much anymore. I don't know. I like to think of it as maybe you have to put less effort into maintaining it then. I mean, there's some benefits, but not everyone thinks
you
that,
earned it,
right? Yeah, like
You-
congratulations, you got to this place. You don't have to manage this anymore.
Congrats, yeah.
We all have enough to manage, right? But not everyone thinks that. Not everyone thinks that.
Yeah,
So, definitely, but you can use a merkin if you feel like you're not, you know, not getting what you need there, I
Yeah.
would be I definitely caution against putting any kind of hair growing chemicals down there on that skin. I think that would be too irritating. And I haven't seen anyone come in with that problem before, but I definitely could see that. I
Yeah.
don't know.
Yeah.
Yeah.
That one hasn't walked in the door yet. But again, we're not really looking at that. But if you had that concern, we definitely could talk about it. So,
Right.
yeah.
Right. All right. Anything else we want to say about pubic hair in general?
I think it's there for a reason, and you can do with it what you want. And, if it gets irritated, then we can kind of talk about other ways that are safer and better options for you. What do you think?
Yeah. I would say like personal choice, your body, your choice.
your
Like
your bush, your choice.
your bush, your choice. That's perfect. I love that. Yeah. I mean, there's not many people that are going to see what you decide to do down there. So you should make it for you. And then go from there. And you should never make it for us. That's, I
Yeah.
think, that's one of the biggest things. We do not care. We will not judge you. Again, I will not think, oh, that's the lady that had that hair
Yeah.
on her pubic. I literally will never, ever think that. And I
Yeah.
will tell you, almost 100% of gynecologists would agree with that.
Yes. 101% for sure.
Yes. Yes. So prioritize what you want for your body and think about some of the health implications that it is there for a reason. But if you like it not there, then and it works for you, that's fine too. And just, I would say, don't do anything that's too hard to keep up or too irritating to the skin. And if you found yourself down a path where you're having irritation, itching, burning, bumps, those are reasons to come out to seek a gynecologist. And if you feel like your gynecologist is not helpful, you could seek a vulvar specialist, especially if it's something that's a chronic thing that's not improving.
Yeah, for sure.
All right. Well, thanks for joining us on this episode about bush or bear. I hope you learned something. Thanks for joining us for this episode of Labia Logic.
We get it. Sharing a podcast like this might feel a little taboo, but we're here to break down those barriers. Labia Logic's all about empowerment, not embarrassment.
If you found this episode helpful, we hope you share it with others who could use a little labia logic in their lives. Can't we all? You can find us on all major podcast platforms and connect with us on Instagram at labia_logic.
From our lips to yours,
Viva la vulva!